All right, welcome everyone. I'm Shay Coker, Managing Director of leading tenant representation firm Savills. If your company needs a new warehouse or new office space, or simply wants to renegotiate with your landlord, please give us a call. Welcome to another edition of Coker's Chronicles. Today, my esteemed guest is Dr. Gilbert Berdine. He's a Harvard-trained practicing physician, associate professor of internal medicine at the Texas Tech University Health Sciences Center, and a faculty affiliate of the Free Market Institute. Welcome, Dr. Gilbert.
Thank you for having me.
Uh, Dr. Berdine, how did you decide to get into medicine in the first place?
Medicine in the first place. Well, when I went to undergraduate school, I was at MIT, and I originally wanted to be a chemical engineer because I really liked chemistry in high school. But the Vietnam War was winding down, thank goodness, for those of us who weren't thrilled about getting shot at. And because of that, engineering was not doing real well, and medicine was a much more attractive option. So I just followed where the opportunities were.
Sounds like my dad. He decided to become a dentist to avoid going to war.
Well, it wasn't so much a decision about how to avoid the draft. I was in the lottery. My number came up 215. My mother wept that day. They only got to number 5, so the war was winding down. But it wasn't so much to get a draft deferment. It was because there weren't really the engineering firms weren't hiring. Apollo was winding down. There just wasn't a lot going on in the engineering field, so medicine seemed more attractive.
I didn't mean to imply you were a potential draft dodger. Don't take me wrong. So I've seen you've been writing articles for the Mises Institute for over 10 years. How did you become interested in free market economics? It doesn't make a lot of sense. Someone from MIT and Harvard to a medical background to become interested in free market economics. How did that happen?
That's really a good question because, as you pointed out, I have a very authoritarian pedigree coming from where I do. The people out there are pretty convinced that they know what's best for everybody. When I was younger, I had much different views, but as time went on, particularly when the Berlin Wall fell, and I just didn't see some of the things that were promised. The communist threat was over. It seemed like we should be getting some sort of a peace dividend. We should be celebrating our victory and going back to being a peaceful society. And the events around that time led me to explore other philosophies, and I became very attracted to the writings of Mises and Murray Rothbard, and a number of personalities doing interviews and it wasn't podcasts back then, but they would do some sort of videos. But Bob Murphy, Tom Woods had a big influence on me.
I love both of those guys. In March of this year, coming up, skipping several chapters of your life and coming up to date, but in March of this year, you wrote an article called Coronavirus and Healthcare Economics, where you stated that healthcare is not a right, and argued that the consequences of the coronavirus response would far outlive the epidemic itself. Can you explain more about what you meant?
Sure. I've written a number of pieces in different forums challenging the idea that healthcare is a right. Healthcare isn't even a necessity. It's a very nice luxury. We should all be very grateful we have it. It's one of the things that makes civilization wonderful, but it's not a necessity. Food is a necessity. If we don't have food, we're going to die. If we don't have fresh water, we're going to die. If we don't have shelter, we're going to die. I would put our utilities, electricity in particular. If we don't have electricity, we have nothing that makes modern civilization possible. Now, healthcare is very nice. It makes it allows us to live longer. It makes us more productive. But civilization would survive quite well if we had no healthcare at all. So it's not a right. And when you think about what a right means, it's not physically possible for healthcare to right. You can't have a right to scarce things. It's just not physically possible. The beauty of economics, when it's thought out properly, is it finds ways to manage the problems of scarce resources without conflict. So avoiding war to fight over things. We find ways to cooperate, ways to share things that work to the betterment of all parties. And healthcare is one of those things. So healthcare fits into a modern economy. The providers of healthcare trade their services to people who want to consume healthcare. And the providers are rewarded, and then we spend our money on other things, and life is great. So healthcare is one aspect of an economy, but there's nothing special about it. Kenneth Arrow is frequently put up as an example of why healthcare is special and it requires government management. But his examples really fall flat. One of the reasons frequently cited is we never know when we're going to need healthcare. You don't know when you're going to be in an auto accident and require trauma surgery. And this is true. We don't know that. But you never know when you're going to need a wedding cake either. And yet we seem to do quite fine with bakeries supplying wedding cakes without the government intervening, except recently in the case of marriages and stuff. But auto mechanics is another thing. You don't know when your car is going to break down. If your car breaks down in the middle of nowhere, the mechanic sort of has you over a barrel, yet somehow we survive all these situations. Our car gets fixed, we go on with our life, and we're not bankrupted by having a flat tire. So these things are all navigable without the harsh consequences that we're constantly being told would happen in a free market healthcare system. And I need to emphasize the U.S. healthcare system doesn't even vaguely resemble a free market. I mean, in the U.S. healthcare system, neither the buyers nor the sellers of healthcare have any idea what the prices are. So that would be a very strange market indeed.
Could you expand a little bit into that? I think that concept is foreign to a lot of people, that the U.S. healthcare system is not anywhere close to private.
Right. We have aspects of private healthcare, but most of it is it's a group of interrelated cartels. So I'm a member of a cartel. I have a medical license. I am granted a privilege, not a monopoly per se, but I'm granted a privilege to practice medicine. So I am allowed to take somebody's blood pressure, look at their throat, listen to their chest, and make recommendations. Somebody who does not have my license can't do so. So I'm protected from competition against people who could provide similar services at a much lower price. So I'm a member of a cartel. The healthcare system, the pharmaceutical industry is a cartel. It's a group of companies that get privileges from the government, patent monopolies, things like that, permission to sell products that other people can't sell. And because of these things, the prices of healthcare services in general are much higher than they ought to be. So that's a big aspect of it. And then you have the whole government supplied healthcare, Medicare, Medicaid. It's very interesting. I mean, I was alive prior to Medicare, and so I do have some memories about it. And I grew up in a low middle class household. My mother was raising me on her own. She worked a minimum wage job, and at one point in her life, she needed to be hospitalized for a DNC procedure. So she was in the hospital for several days. And it is hard to imagine someone today going into a hospital, having a surgical procedure, and being in the hospital for 4 or 5 days and not being bankrupted. And yet, it was no big deal. We paid for it out of savings, and life went on. But today, a week in the hospital would bankrupt almost all people. Very few people could afford that, and so the system has become crazy. We went from a system in 1964 where over 90% of people age 65 or older paid for their health care out of pocket. And we have gone, in order to solve the problem of the 10% who couldn't afford health care out of pocket, we now have a system where virtually nobody can afford health care. And so the solution has become far worse than the problem was. And we see this in healthcare. It's just a never-ending short-term fixes to problems the government previously created, and then the solutions create even bigger long-term problems. And coronavirus is just the latest example of that.
That's a good explanation. You touched on several aspects. I know that medical tourism is to other countries has become popular due to the high cost of medical care in the U.S.
Yes, it's a multi-billion-dollar industry now. So the situation is you have physicians in other countries. India is a good example. So if you are not in the middle of a heart attack, but you simply have coronary artery disease and you want to have a heart catheterization to better define your disease, you have the option of getting your procedure here, or you can go to India, stay at a 4-star hotel for a few days, see the Taj Mahal, whatever, and it'll cost you half as much as getting your procedure here. So the prices here for many things are much higher than they ought to be. Obviously, other people are benefiting from this, but it's not serving the community well.
Right, and so is that the fault of greedy corporations, or is it more have to do more with our system?
Well, corporations are greedy. I mean, that's their purpose. Their purpose is to make money. So, of course, they're greedy. However, you can channel that greed to useful purposes, or you can let the greed be exploited for less than wonderful purposes. The problem is not the corporate greed. The problem is the privilege that they are given by government to exploit the greed. So if corporations use their greed to provide services via a market that people purchased voluntarily, they would be providing a wonderful service, and their greed would be performing a great function. However, when the corporation is granted a monopoly to provide something, and they charge an outrageous price because of the monopoly, and then they are further aided and abetted in their extortion by public subsidies, this is how their greed gets out of control and causes great harm. But they could not do this on their own. They can only get away with it with government permission. So ultimately, it's the government causing the problem. The corporations left to their own devices would simply be providing services that people want.
Right.
Can I give an example? I like to use two examples to illustrate this. Is there are some aspects of healthcare that are very competitive and very affordable. All of healthcare is not a mess. So we have this drug, acetaminophen. It's widely available. You can go into any store and buy a bottle of 500 tablets. Most people keep a bottle of some tablets in their medicine cabinet. So if you have a fever, you have a sore throat, you have something, you can take Tylenol. Okay. Nobody is asking for insurance to pay for Tylenol. There are no problems with product quality. There are no companies trying to poison people. There are no companies trying to gouge people. The competitive nature of the market guarantees that we get a good product at an affordable price. Another example is something that I work with, CPAP machines, continuous positive airway pressure. It's used to treat sleep apnea. If you look at a CPAP machine, it's about the same size, the same complexity, and the same use of materials as a toaster. You can get a toaster for $20. The only need that you have to demonstrate for a toaster is if you have $20 to give to the salesman, and he will then ask you, what color would you like? So in the healthcare system, to buy a comparable piece of equipment to a toaster, you first have to demonstrate need by taking a very expensive test. Then you have to pay an outrageous amount. These machines cost anywhere from $500 to $1,500. And it's all because of government privilege. It's not because they're protecting us from something or they're making the item safer. We don't need government assistance to guarantee that a toaster works. We shouldn't need government assistance to make sure a CPAP machine works. The market will take care of that.
That's a great example. So back to that article, you said that healthcare is not a right. You explained that, and you also mentioned that back then in March, that the consequences of the coronavirus response would far outlive the epidemic itself.
Yes.
And what did you mean by that?
Well, Sweden is a good example. They had a relatively hands-off approach. And basically, the pandemic is over in Sweden. So we're about 4 months out, and they have near zero deaths every day. And they have a very low number of cases. And basically, they've achieved herd immunity through natural processes. And they're done. So life goes on in Sweden. They didn't have a lockdown. They did have a recession, largely because the neighbors they trade with were all under lockdown. But Sweden will recover economically much quicker than other parts of the world. And they will not suffer from the economic deprivation that's occurring in many other places in the world. So they're not going to have the problems of massive unemployment. They're not going to have the problems of depression related to massive unemployment. They're not going to, they're not going to have suicide issues related to unemployment. Unemployment is one of the most difficult things to cope with. It's very comparable to losing a spouse, losing a child, in terms of the stress that it puts on people. It drives people to substance abuse. It drives people to suicide. It can just turn normally well-behaved people into monsters.
No doubt about that. And I get mixed messages in the media about Sweden. A lot of people say, well, it suffered a higher death rate than neighbors, maybe Finland and Norway, Sweden's a very different country. It's smaller, it's more spread out. It doesn't have the the same characteristics as a New York City, for example. What would you say to that?
Well, I think Sweden has gotten a very bad rap. They basically took their deaths up front and got it over with, and now they're essentially going to have no more deaths. So you have the United States, for example, which initially looked like it was going to have a lower mortality than Sweden, but the deaths keep accumulating. And at some point, we'll pass Sweden in terms of the United States as a whole. Some of the states had disastrous policies. New York was a catastrophe. New York did about everything wrong. So they had policies that ensured that the virus would spread very rapidly amongst the elderly population, which is where most of the deaths occur. And so this happened very quickly. And by the time they locked down the rest of the city, they basically had ensured they were going to have the maximum number of deaths. So their lockdown really didn't accomplish anything. They closed the door, the barn door, after the horse had left. You see other places. Texas is a good example of how the lockdowns had an effect, and they did impact the spread of the virus, but it didn't solve anything. It just deferred a problem. So in Texas, when they finally relaxed the restrictions and let the economy open up, the virus started to spread again. And when I wrote this article a few weeks ago, the mortality per million population in Sweden was, I think, like 550, and Texas was 270. When today, Sweden is like 560, and Texas is 400. So Texas is catching up. It will almost certainly pass Sweden in terms of mortality. And it's because the lockdown didn't solve the problem. It did stop the spread of the virus, but the virus is very patient. It isn't going to go away. And as soon as you relax things, allow people to interact again, the virus will resume its spread, and it will keep spreading until it runs out of hosts. And that's the process of herd immunity. So slowing things down just means more people die.
Wow, that's scary. So, yeah, I was going to mention. So your article that came out this week was called "Why Americans Should Adopt the Sweden Model on COVID-19," where you compared all those rates that you've been talking about between Sweden, New York, Illinois, and Texas. If we could do it all over again, what would you recommend?
Well, what we've learned is that older people are at the greatest risk. The age 50 is a nice number to work with. So 98% of the deaths are 50 and over. 2% of the deaths are 49 and younger. At age 45, you get 99 and 1. So above age 50, the mortality starts to go up significantly. But half of the deaths are in people over the age of 80. So it's clear you need to target your policies to protecting the elderly. There are ways to do this, and there are things we can do. So in institutions where the elderly are congregated, you want to have measures that prevent everybody from being in contact with everybody else. You don't want people in isolation, but you want them in smaller groups of 2 or 3. You want to make sure that the young people coming in contact with the elderly are observing good hygiene. The masks may very well have benefits in these interactions. But what you don't want to do is destroy the economy. And the young people who have very little to fear, and not zero. I mean, there have been deaths in young people, but if you're under 14, you're more likely to die from a lightning strike than from COVID-19. So shutting the schools down was a huge mistake. The children need to learn. The children need to learn, especially, how to get along with other children. The socialization aspect of school is very important. You can't do this by Zoom. Children have to interact with each other. And you're going to have very few medical consequences, not zero, but very few. And then basically the virus spreads and there's no more children to spread, and it stops. And that's when the virus stops. So that's what you've seen in Sweden, is the virus has spread to the entire young population. It has no place to go, and it's done. Now, they will probably have another outbreak in a year or 2 years when the situation changes sufficiently. But what we've seen in all these lockdown areas, they thought what they were going to do was stop the spread of the virus until the virus died. But the virus has not cooperated. Hasn't died. It's still there. You've got the problem of the virus being in other parts of the world, and you have international travel. That's one aspect, but the virus clearly goes dormant. We know this from flu. We know this from other viruses that never completely disappear. I mean, even measles has never completely disappeared. You don't eradicate it. It simply runs out of hosts, and then you're done with it until the circumstances are ripe for a new spread. So you have a mutation, or you have a profound change in the host conditions or something that just allows the disease to take off again. And this is usually 1 or 2 years apart. And that's why we have these outbreaks every year of the flu. The flu is never going to be eradicated. It's part of our ecosystem. COVID-19 is going to be the exact same thing. It will never go away. It will be there, and we will have to learn to live with it.
Just out of curiosity, do you know why they named it COVID-19? It seems like a scary name. They could have named it something a little bit more gentle.
Well, I don't know exactly what was motivating. I think a number of things about the name were very unfortunate. Why is it called the novel coronavirus? There's nothing novel about it. It's basically a cold virus. It does have different properties, and I don't want to get into the debate about whether this was man-made or not. I happen to think it was, but I'm going to let other people who know more about it discuss that. But there's nothing novel about it. It's very similar to the other coronaviruses, and the problems we have going forward is vaccines, for example, have been very ineffective against coronaviruses in general. There's no reason to believe that this vaccine will work any better than it has in the past. I don't think it will work any better than the flu vaccine. I mean, it offers some benefit, but it won't eradicate the disease. And yet the media talks about as soon as we get a vaccine, the problem will be solved. It won't be solved. It actually won't be much different than what we have to deal with today. They'll give the vaccine to everybody, and then when they open up the economy and the schools, they're going to have another outbreak.
I forgot to mention to the audience that feel free to ask questions, and looks like we already have one from Adam Singer here, and I'll put it on the screen. He says, Shay, kids going home to family members with pre-existing conditions when they come home from school, how does Gilbert address that?
Yeah, that's a great question. So the children are at low risk. However, older people who are in their households, that's a different story. I grew up when everybody had the measles. Everybody got the measles. It was not considered a big deal. In fact, if somebody in the neighborhood got the measles, there would be a party so that all the kids would get it at the same time, and it would basically, you'd be done with it in a week. I'm not suggesting we approach this problem that way. So if you have elderly people living in the same house as school-age children, the school-age children are going to have to be careful. They're going to have to be very attentive of fevers, of any symptoms they have. And here is where the concepts of social distancing and masks can be put to good use. So if kids are coming home from school, they probably don't need the masks at school. Where they need it is to protect the elderly people in the household from them. I think the masks in general are misunderstood. The purpose of mask is not to protect the wearer from getting something. The purpose of the mask is to protect everybody else from something the wearer might have. Masks are not very effective at preventing you from acquiring something. What it does is when you cough, it doesn't eliminate what you spew out into the environment, but it can cut it down. You can trap a large number of the liquid particles, so you can cut down what goes into the environment. I happen to think viral load is a very important issue. So even in situations where people are spreading things, engaging in behavior that minimizes viral load probably results in fewer serious illnesses. So how should we deal with the children coming home? Well, for one thing, if the older people have options of living outside of where the kids are going to be, that would be a good choice. So maybe when they open the schools up and you have a flurry of COVID activity in children, this is not the good time or the best time for grandma to visit the grandchildren. Maybe wait a few months and get back to socializing with the grandchildren after the problem has already settled out. I think there are things that can be done, but they have to be done on an individual basis. Each family has to decide what's best for itself.
I think part of his question had to do with the actual kids having pre-existing conditions.
Oh, okay.
For example, diabetes.
Well, the children have low risks irrespective of that. But, let's say there's a child. I mean, let's take an extreme example. A child has an immunodeficiency who would be at very high risk. Or let's say the child has HIV through no fault of the child, inherited it or whatever. Acquired it from the mother, let's say. How do you deal with that? Well, these cases, maybe these children shouldn't go to school. Maybe they should be protected. But these are going to be the exceptions, not the rule. Again, the market is very good at dealing with complicated problems. Government rules are only good at targeting the average case. They're not good for the outliers in both tales. So these questions that come up, they're about how do we handle outliers? Well, the best way is for the guardians or the individuals themselves to be knowledgeable about the risks and then make informed decisions about what best to do. So the individual who's at risk needs to decide whether the risk is worth it or not. It may be, if you're immunodeficient, it might be that having remote schooling or having homeschooling is a superior option. And I don't think we should try to make everybody fit into the same into the same policy.
And there's some great homeschooling programs, one by Ron Paul that I often promote, that seems to be pretty good.
Yeah, homeschooling may become a big beneficiary of this whole thing.
Absolutely. So what do you think about these mask mandates? Is that going to save the lives of everyone when you are required to wear a mask in the first 5 seconds of walking into a restaurant and then taking it off to eat?
Yeah, I'm not real thrilled about mandates or government mandates. I'm have mixed views on the mask. I think my first thought about the mask, when this first started, even before Texas went into lockdown, my wife made me promise her I would wear a mask at work. I haven't missed any work through all this, and she made me promise, and I did it to ease her mind, not because I thought it was actually doing any good. But since then, I've kind of moved in towards the other end of the spectrum. I think the masks do have use. I think there really is the viral load is very important about, these unusual cases where young people get very sick and some deaths. I think these people were exposed to very large viral loads, and a lot of this can be prevented with better hygiene. So I'm not an opponent of masks per se. I think they serve a purpose, but they need to be used intelligently. A lot depends on the prevalence. So if you're in a situation where the prevalence of the disease is 1 person in 100, making everybody wear masks, unless you're in very large groups, doesn't make any sense at all. Now, if you're going to have large assemblies of 200 people, well, then maybe it makes sense, because if it's 1 in 100 and you have a group of 200 people, you have a pretty good chance of having 1 or 2 sick people in your group. So the masks may make more sense in that situation. I think the masks, where they're helpful, are these interactions between young people and the elderly. So people working with the elderly in nursing homes, people who are working in healthcare facilities, things like that. I think the masks have much greater utility in those situations. But the mandates, everybody has a different situation. So I take walks outside. I never wear a mask when I'm outside, but I'm mindful. If I see somebody coming down the sidewalk, I move out into the street so I won't go anywhere near them. And I think most people are courteous. They understand that we're just trying to avoid conflict. We're not trying to hurt other people. But I think making people wear masks all the time in every situation is silly. There are situations where it probably has value and should be done, and there are other situations where it's stupid. So I think, and unfortunately, the government's not very good at distinguishing between those two sets of circumstances. So I think leaving people to make these decisions is much better. Now, on private property, you have a really different situation. So in my house, let's say, if I want to have a dinner party at my house and I'm going to have 10 guests, I might very well decide everybody has to wear a mask. Of course, the dinner itself, they're going to have to take the mask off. But, in your own home, you can dictate what the rules are. And if people want to enter your home, they got to follow the rules. But trying to make everybody follow the same set of rules is not going to work very well. And I think the best thing to do is educate people about why the masks are useful, educate them that they're not doing it to protect themselves. I see some people refuse the mask because they think they're being a sissy. Well, that's not why you're wearing the mask. You're wearing the mask to protect other people. And if it's explained that way, then these people might have a different attitude about it. So I think if we, I think this is a very stressful situation for everyone. And I think what we need most of all is to be a lot more understanding and just and accommodating. And we just need to try to get along and cut people some slack. The social distancing, I think there's some merit to it. Is there anything magic about 6 feet? No. And people who, pull out a taser if somebody gets 5 foot 10 inches from them, that's just crazy. So we should be trying to avoid extremely close contact. We shouldn't be packing people like sardines into subway cars. But 6 feet is 6 feet. You got to be 6 feet apart. I don't think it's that kind of thing. And I think most people are capable of common sense if you give them the chance.
Yeah. Um, so I understand that you're a practicing physician and you also teach at Texas Tech Medical Center. Have you treated COVID patients personally?
Well, I don't treat them directly because I'm 66, so I was forbidden to be in contact with anybody known to have COVID. Uh, the policy hasn't worked perfectly, so I have come in contact with people. I try to make sensible decisions to handle those contacts, but for the most part, I'm not directly caring for these people. However, I've been following this thing very closely. I'm very familiar with what's going on. My stepson came down with COVID, and I counseled him through this. My daughter is a nurse in Dallas in a neurointensive care unit, and she's asking me questions about COVID all the time. So I stay pretty abreast of it. I look at a lot of X-rays and CT scans, so I see what it does.
Right. So wrapping up, is there anything that you'd like to mention that we haven't covered regarding either COVID itself or the reactions to it, or a free market healthcare system versus a government-run healthcare system?
Well, sure. I mean, just to summarize, so let's take the COVID response as an example of government supply, mandated healthcare. The government likes one size fits all approaches. It likes check boxes. So everybody is, you're all lined up like you're in the Army, and you're all going to get the exact same tray full of food or whatever, or treatment. And unfortunately, we're all different. We have different circumstances. So like with this COVID, the risks of interactions, the older you get, the more the risks are. It makes a big difference whether you're employed or not. Losing a job is a much bigger deal than they made it out to be. I think one of the things we haven't touched on, but is coming to light, is the importance of savings. If you have savings when you have a crisis like this, you have much greater options to weather the storm. You have the ability to say, I'm going to take 2 weeks off until the worst is over. If you don't know how you're going to make your next month's rent check, you don't have that option. You basically have to go to work, regardless of how safe it is. So I think we've really had a catastrophic government policy encouraging people to take on debt and to not save. Savings, I mean, mainstream economists view savings as something horrible. It's the devil's work to save money because you're not spending it. And now we see that savings, that's how we survive things like this, is we can step back and we can be more cautious because we don't have to be earning money every day because we have some put aside for a rainy day. And I wish everybody had that benefit and they had that opportunity, but they don't. A lot of people cannot afford to be off work for a month. They have to put food on the table, so they have to take risks. Now, we need to try to find ways of making things work as best they can. The situation, though, is much different for a 20-year-old than for a 60-year-old. I think entrepreneurs, if you're a restaurant owner, do you want to cater to young people? Do you want to cater to old people? If you're catering to old people, you're going to probably need different policies than if you cater to young people. And I think one of the outcomes is we will see people specializing rather than trying to be a family restaurant. They're going to specialize in serving young people or elderly people. And those environments will be much different. Like I said, this virus isn't going away. So some of the concerns about social distancing and whatnot are going to be here for a long time. And we're going to have to cope, and we're going to have to learn how to deal with this. We aren't going to solve it.
Awesome. Well, let's hope we can follow more closely in Sweden's footsteps and get rid of the virus for all practical purposes.
I hope so.
Dr. Berdine, thank you so much for joining me today, and really appreciate it. It's been very valuable.
Thank you for having me. This is a very nice opportunity for me to get some messages out.